This conference will now be recorded.
And Paul, thank you so much for bringing us this Medicare Basics seminar today.
Lawrence, yeah, you're muted. Okay, everyone's muted except me and Jay, or Jay and I should say. Okay, uh, as I said, we're going to first go over the ABCs and Ds of Medicare. I'm going to bring up a chart which shows it. And this is the way it looks. As you see, Part A is a hospital, and there's some numbers, some dollar figures below that. Those are the copays that the beneficiary would be responsible for, because when you sign up for Medicare Part A, that only covers 80% of whatever the your costs are. And if you are hospitalized for the first 60 days, there's a $1,408 deductible or copayment, however you want to think about it. Then from days 61 to 90, it's $352 per day. And anything over 91 days and 91 on, $704 a day. So you could see if you've only had Medicare Part A, you would be subject to quite a bit of costs. So, we're going to go over a little later how you mitigate those costs. The next section, the Part B, those are doctor's costs. Also, injectable drugs that are done at a doctor's office. What else? Skilled nursing care, things like that. Okay, that's under Part B. The average cost, unless it can go up based on your taxable income, based on your previous year's tax return, but the minimum cost is $144.60 a month. That's what I would say the largest percentage of people pay. Then there's an annual deductible of $198, and you are also subject to paying 20% of that. This also covers only 80%. That's where Part C comes in. Okay, well, let me skip over to Part D, actually. That's prescription coverage, drug coverage. If you don't have what's called credible drug coverage, and credible drug coverage is the coverage will pay as much or more than normal would have to be paid. So you would want to sign up for one of these plans. Even if you have just Medicare Part A and Part B, you're still required to get Part D if you don't have the credible drug coverage. And these plans are administered by private companies, and there's a monthly premium. And you can see there's a range, $16 to $106. There's copays, and a lot of times there's deductibles. And if you've ever heard the term donut hole, this refers to part of the Part D. When you're in there, there's an initial coverage, there's a deductible, then initial coverage. There's the period in between that they call the donut hole, and then it's catastrophic. That's after that. And the dollar amounts that you have to pay towards those are quite a bit. It's I think it's $41.50 now before you get into the donut hole, and then it's over $6,000 before you get into the catastrophic. But there's different parts of that too. They figure that amount. It's not all out of your pocket during the gap coverage. What the insurance companies pay towards the drugs are included too, to get you up to the figure to get into the catastrophic stage. This is mainly concerning for people that take a lot of medications. If you don't take a lot of medications, it doesn't impact your financial situation as much. Okay, so now the part that I skipped, the Medicare Part C, there's two different plans under this. You'll hear the term Medicare supplement. The most notable one is the United Healthcare or AARP plan, but there's other companies that have them too. Empire is in New York. I think Mutual of Omaha, but the two biggest ones are United Healthcare, AARP, and Empire. Okay, Medicare supplement, how that works, that picks up the difference between what Medicare Part A and B don't pay, and this can cover some or all of it, depending on the plan you have. And if you see again over to the left, there's different plans, and they have letter designations from A to N. The most typical ones are the F plan, the G plan, and the N plan. With the supplement plans, you actually pay before because you have a monthly premium. Typical premiums are about $190 a month up to about just over $300. I think $309, $310 a month, depending on the letter plan that you have. If you get a Medicare supplement, and as I mentioned before with the Part D, you need to have Part D coverage. You need to have prescription drug coverage. Medicare supplements don't cover that, so you need to get what they call a standalone Part D prescription plan. Since 2006, that's the requirement. Okay. The next box over where it says Medicare Advantage, that's also under Medicare Part C. And when people say Medicare Part C, they usually refer to this. They kind of separate Medicare supplements, but they're both part of Medicare Part C. The Medicare Advantage plans, you can get some that cover only the medical portion, but most people sign up for what they call an MAPD, which means it's Medicare Advantage Prescription Drug Plan. That means your medical portion and the prescription portion are all in one plan. These are administered completely by private insurance companies. For instance, if you had an Aetna plan, when you go to the doctor or you go to the hospital, you show a card that's sent to you by Aetna, Humana, whatever plan that you have. Whereas with the Medicare supplement, you still would use your Medicare card, the red, white, and blue card that you get from Medicare. Okay. With the Medicare Advantage, you pay as you go, meaning that sometimes there are monthly premiums for them, but there are a number of plans from different carriers that can have a premium as low as $0. Again, as I said, you pay as you go. So these have co-pays for your primary care doctor, specialist. If you go to the emergency room, some plans have a small deductible, but some don't have any deductible. The drug portion, there's different tiers to that. That means that depending on the medication, it may be in a different tier. For instance, most of the either the Medicare Advantage or the standalone Part D plans, you have 5 tiers. Some plans have 6 tiers. But typically, if the Medicare Advantage plan or the Part D plan does have a drug deductible, a lot of times deductible doesn't apply to tier 1 or tier 2. Tier 1 is preferred generic, tier 2 is generic. So if you're taking generic medications, a lot of times you're not subject to the deductible. But if you go into the higher tiers, 3, 4, 5, 6, if they have it, you're most likely going to be subject to the deductible. And a lot of times people will see a low premium on their drug plan, whether it's through the Medicare Advantage or the Part D plan, and they'll go for that. But what happens, you have the deductible, then you have monthly co-pays. Sometimes it's better to pay a higher premium monthly, and you may not have a deductible or a lower deductible, and the co-pays will probably be lower too. But that's something that someone like myself, an independent agent, can go on. We have software. We can put your information in and come up with a plan that's maybe should be most appropriate for you, meaning it has the coverage you want, the coverage you need, and also the costs are low. Now, also in the Medicare Advantage plans, there's two types of plans, typically HMO and PPO. The HMO, you have to stay in network. If you go out of network, you're going to have to pay everything, you incur the entire cost. With the PPO, you can go in or out of network. You stay in the network, your costs are going to be lower. You can go out of network. You're not going to pay the whole thing, but you may have a little higher copayment or co-insurance. There's two things. There's co-payments, as you see in the box below the Medicare Advantage box. There's copays, deductibles, and co-insurance. Most people know copays, and deductibles. Co-insurance is a percentage. For instance, if you have an outpatient surgery, you might have a flat rate, copayment, or co-insurance. Most people see the wisdom of going with one that has a copay or a flat rate for a outpatient surgery, because they're not, their costs can be costly. If you're paying a percentage of it, well, you're not going to know until you get the bill what your portion of it is. Whereas if you have a flat copayment for a procedure like that, then you know ahead of time what you're going to pay. Okay. Then those other two terms for MOOP and TROOP, that's MOOP, that's maximum out of pocket. On the Medicare Advantage plans, you have, there's a limit set by, the insurance company that administers the plan, but they all kind of stay within a range. Typically, it's anywhere from $4,500 to $6,700 a year. Now, a lot of people hear that and they think, oh, I have to pay that much. No, that's the maximum you would pay. We'll say we'll take a PPO plan, and if it has a $6,700 in-network out-of-pocket, maximum out-of-pocket. If you had a catastrophic health year, you were in the hospital a few times, you had procedures done and things like that, the most you would ever be responsible for would be that MOOP. And if it's $6,700, that's not chicken feed. It's a decent amount of money, but at least that's the maximum you would be responsible for. So you're not going to have a $40,000 or $50,000 bill that might bankrupt you. And then TROOP is usually associated with the prescription portion of it. And again, that's true out of pocket. There's a formula with what the insurance company pays and what you pay to come up with the TROOP. And there's usually a limit on that also. It works the same way as the MOOP also. Okay. I'm going to go to another set of information here. Once you're on Medicare, every year you receive this book, Medicare and You, and as you see, this one is 2021. And they were sent out. I received mine. I am a fellow Medicare beneficiary. And let's see what. Okay. Now, just to go over, we're going back. This is showing the different time periods. October 1st is when you can start comparing your plans. We're in AEP starting tomorrow, October 15th to December 7th. During that time, if you're already on a Medicare plan, not the original Medicare or Part A and B, that you're going to just stay with. If you're already on a plan and you want to make a change, you can make any change you want and as many changes as you want during this time period. If you see one plan, then you change your mind, you see a better plan, you could make that change. And the last one that you sign up for by December 7th will be the one that you would be going with. And that coverage is effective as of January 1st. And then there's another period that you see there, January 1st to March 31st. That's called OEP, open enrollment period, to differentiate it from the one starting tomorrow. That's AEP, annual election period. And the OEP, that really mainly applies to people that are on Medicare Advantage plans. You can make, if you sign up for a plan during AEP, you can make a change to a new plan during the OEP. Okay. Now, this is a page that shows the different parts of Medicare. Part A is the inpatient care, skilled nursing facility, hospice care, home health care. Part B, services from doctors, outpatient care, home health care, durable medical equipment. It shows you there wheelchairs, walkers, many preventive services like screening, shots, vaccine. And again, as we mentioned, Part D is the drug coverage. Okay. And let's see my notes here. Okay, I want to touch a little bit on the medical supplements. Okay, in the Medicare Advantage plans, they have let me back up. The Medicare supplements are just medical coverage, doctors and hospitals and that type of thing. But they don't have additional types of benefits. And a lot of times people want dental, they want hearing, they want vision. That's not covered under supplement plans. The Medicare Advantage plans, most of them have that. Either it's like with dental, it might just be basic dental, but sometimes there's a rider you can add on, usually for a few dollars a month, where you can get comprehensive dental. There's usually, vision. I mean, you can get an eye exam, but any coverage for corrective lenses, glasses, or contact lenses, usually have to add that in. And then there's hearing aid coverage too. Again, you can get a hearing exam every year, and most times those are no charge because it is like a screening. It's preventive, and some plans, Medicare Advantage plans, have coverage where they pay towards hearing aids. Some have very good coverage. Some have just a little bit, anywhere from $500. I've seen some plans where they allow as much as $3,000 maybe every 2 years towards hearing aids. So if someone is interested in something like that, and they might look towards the Medicare Advantage. But one of the things that you have to consider is someone that takes advantage of health services a lot. If you go to doctors frequently, maybe you have a condition where you have to get injections on a regular basis, or people have had other health issues where there's quite a bit of care every month. Sometimes a supplement plan is the most appropriate. But if you're not in that situation, if you want to, if you feel that you don't need that, you only go to your primary care doctor once or twice a year, maybe you see a cardiologist once a year, dermatologist once a year, something like that, Medicare Advantage might be the way to go. That's something, you have to decide on whether you think that's it. But the advantages of the Medicare Advantage plan is that you can get these additional services included. It's just the way they're structured. I'm trying to think of anything else. I think that's hopefully that's a lot of information. If you have a particular question that you want to ask about anything right at this point. Anyone? Yeah, you got unmute. You say, yeah, you go.
Paul,
Yes.
being that I would be starting this December 1st, which is the last month of the year, how would that work?
Okay,
I mean, like if I pick an Advantage plan, it starts December 1st and then I start a new plan January 1st? You know?
okay. Your birthday is in December?
Yeah.
Okay, so you're eligible, yes, December 1st. You can sign up for a plan December 1st. And if you like that plan, no, it just rolls over. It's like medical insurance. If you don't make a change, well, actually, the company would roll you over, meaning for December, you would have a 2020 plan, and then
Right.
January 1st. Sometimes there's changes, but they're usually minimal. But yeah, you don't have to re-sign up. You're going to go right over. For instance, I know offhand there's a plan called the Aetna Elite PPO plan. Say you signed up for that. You would go in January 1st, you would still be in the Aetna Elite PPO plan. Any changes, say there might be a difference of a couple of dollars on the copayment for a specialist. Well, you would be subject to that, but you would get the information. If you didn't get it from Aetna, whoever you sign up with, they could find out that information for you. For instance, the 2021 plans have already rolled out. So someone like myself, I have access to look at the 2021 plans, and we can discuss that at this point. But like I said, it's a minimal. The coverages, all the things that are covered, doctor's visits, hospital, preventive dental, preventive vision, those things are not going to change the services, but there might be a couple of dollars here and there. Like, for instance, that plan has a medical deductible that you're only going to be subject to if you go in the hospital or you have an outpatient procedure, and then that cuts into the deductible. Say you had a procedure that you had to pay $500 for. Well, now you would only go and you had to go to the hospital, and you would only have $500 left on your deductible, and then it's a flat rate. So it's under $2,000. If you went, say you didn't have a procedure and you went to the hospital, it would be somewhere in the vicinity of $1,700 or something dollars that you would be responsible for the hospital, and everything else pretty much is covered. But so going forward, that flat rate might change next year. Instead of being $725, it might go up to $750 or something like that. It's going to be very minimal. And then the drug charges, the deductible, and the copay is probably going to be similar. So yeah, you don't have to re-sign up. You stay with the same plan. And it's good. You can call a company and do it, but they're only going to talk to you about that one company. Whereas if you speak to an independent agent, they're usually certified with more than one company. Like I myself, I'm certified with 14 different companies. So a couple of them are in other states too. So in New York State, I'm probably certified with 10 or 11. Because you have to, not every carrier's plan is appropriate for every person. So that's why you need to have a full portfolio of plans to get the one that's right for the individual beneficiary. Did that answer your question?
Pretty much.
Okay.
I have a second one.
Yeah, absolutely. Go right ahead.
I'm looking at an Advantage plan, maybe MediBlue.
Okay.
What I want to know is if I'm out of town, say I'm in another state, would any doctor that accepts MediBlue handle anything that I had come up?
Okay. Is it a PPO or an HMO?
This is an HMO.
If it's an HMO, then you have to stay in network. And I think the MediBlue might only be good for like the local states. Like if you're going to travel, sometimes a PPO is better. For instance, again, I happen to kind of like Aetna, but that doesn't mean it's appropriate for everyone. They have what they call the seamless network. That means if you live here in New York and you sign up for that plan, if you go to Florida, where they're in 46 different states. When you go to Florida and you go to a doctor there that's in the network, and their network is huge, but so is Empire's, the MediBlue. They have they're the two largest networks in this area. If you go to a doctor in, say, Florida, and they're in network, you would pay the same copay there as you would here. Whereas if you're in an HMO, I don't know that you're covered unless it's an emergency. Emergencies are covered anywhere, even out of the country, up to a certain dollar limit. So, you have to be careful with an HMO. If they have the PPO, that might be better, or you might want to, if you regularly travel, where is it Florida you go to? Is it somewhere else?
I want to get a trailer. I want to go to a lot of places.
Okay, well, you would, one of two things, either a company like either Aetna or Humana that are in many, many states, or you definitely want to do a PPO, because then you can go to any doctor, but you have to tell them that what company you have, or you do a supplement plan, because supplement plan is good anywhere, even in Puerto Rico, Guam, any protectorate or Commonwealth of the U.S., whatever they're called. So you have a supplement, but you're paying a monthly premium.
Were you just saying about the Advantage plans being, if you're overseas, if you're out of the country, I got the impression Advantage didn't cover out of the country.
They cover up to a certain dollar amount for foreign travel. The supplements do too. It's up to about 50,000. I mean, it may not be, every Advantage plan may not have that. You have to look at which one it is.
Yeah, I didn't see that. Okay, thanks.
I mean, I can find out from you if you'd like. I'm going to give you my contact information at the end. And even if it's just a question, you can call me or email me to find out.
Appreciate that.
Sure.
I have a question, if that's okay.
Absolutely. As many questions as you want.
Oh, thank you. I can't see anybody right now. Is anyone seeing each other?
Are your eyes open?
My eyes are open, and all I have on my
okay.
screen is Medicare Basics and the organizer. But I don't see, and I've got my camera on and my microphone on, so I don't know. But anyway, I guess you can see me though, right?
Yeah, I don't know why you're seeing that, because I took that off the screen.
Yeah. And now I'm seeing now it's back, the Medicare Basics. Oh well, I can still ask my question though.
Yeah, absolutely.
I'm in a different situation because I'm on SSDI. So I have had Medicare for the past 10 years, even though I'm younger.
Right.
But I'm turning 65 in January.
Right.
And I do have my supplement plan through my employer.
Right.
And that's through United Healthcare.
Right.
I don't know if it's the best plan for me, because now tell me if I'm kind of approaching all this wrong. I don't need a lot of care. I just, I had an accident and I had surgery, and it's just a permanent injury. So right. I only go for my well visits anyway. So I look at the premiums that I'm paying and, add all that up times 12. And, it's a lot, because, it's $144.60 for Part B. And then right. with my supplement plan, it's another $150. So, you're talking $300 times 12. And I don't think I use even that much healthcare. So the numbers that are important to me are something with a low premium and something with a low out-of-pocket maximum. Because if I have a low enough out-of-pocket, I know I can put this money that I'm spending on premiums aside for that. Does that make sense?
Yeah, no, exactly. And so you said that this is, I've come across people before, they have a supplement plan that,
Hmm.
was it, are they paying for the supplement, or is it employer group Medicare coverage?
No, I'm paying for the supplement through my employer, and the deductible on the through my employer is 3,500. So before I even could use that, I'm
Okay,
thinking I'm going to be spending 30 something, 3,000 something for just the premiums, and then another 30. I'd be paying 6,500
right,
if,
okay,
yeah. So
right.
that just doesn't seem sound to me.
Now, when you go to the doctor, do you have a copay?
No.
Okay,
But even if I did, the times I go to the doctor, it's usually preventative, so it's Medicare
right,
picks up all that.
yeah,
And I don't care about a copay, a $40 copay. That's not as important to me as, what I'm paying, even if I don't go to the doctor. You know,
okay,
like I'm paying 3,500 a year, even if I never step foot in the doctor's office.
okay. Um, I don't want to, because we're in front of other people, I don't want to dig too deep into it. I think
Okay.
we should speak on the phone, and I
Okay,
can
that
answer
sounds
your
good.
questions,
Okay.
because I think there might be a way we can go
Okay.
uh, to save you money, especially since you say you don't, you know, the Medicare supplement plans are more appropriate to people like I had a couple of people that I signed up, they had $300 and $400 a month in out of pocket. So
Hmm.
it paid for them to do a supplement plan, even the
Sure.
highest, but if you don't have that kind of out of pocket, it
Hmm.
may not be needed. But you have to think about what the impact would be if you come off that. But since it's through the employer, it's probably a different situation.
Yeah.
I suppose that once you're 65 in New York State, it's guarantee issue. Like if once you hit 65, you can sign up for Medicare supplement, no questions asked. Because
Hmm.
now you're in a different, I believe you're going to a different category. Because,
Right.
I know what you have, and we tell people anyone that's on that kind of assistance for 24 months is eligible for Medicare. Did you have to wait 2 years when you signed up, or was that easier?
Yes.
You had to
Yes, you're
wait two
correct.
years, right? Yeah.
Hmm.
Okay. Okay. So
Okay.
yeah. So at the end, I'm going to put my information on. You can copy it down and you can give me a call.
I hope if I can get rid of this other screen.
Okay. If not, well, if you have something there, I'll give you my cell phone number.
Okay, I'm ready.
516
Okay.
287
Okay.
0463.
0463. Terrific.
My name is
Thank
Paul
you.
Donahue. Okay.
Thank you so much. I
You're
appreciate that.
welcome. Okay.
Okay.
Lauren, anything?
I'm actually doing this and getting this information from my dad, who just went on Medicare as effective October 1st. And I was actually just looking at, I got somebody giving us some information about Medigap plans, but I'm looking at what you're saying, and my dad just wants to go to the doctor, for annual checkups. As of right now, he doesn't do any regular visits. So I would possibly want him to talk to you about just doing, maybe the basic coverage, like an Advantage plan, in case something, he's got extra thing above A and B.
Oh yeah, he definitely should get an Advantage plan. Going on a Medigap plan, a lot of people say, "Oh, I don't pay anything when I go to the doctor." But I said, "Yeah, but you're paying $250, $300 a month to not go to
Mhm.
the doctor." So an Advantage
Yeah.
plan can be a better fit. It sounds like it probably is for him. So again, did you take my phone number down?
Yes, I did.
Okay, but I'll show you on the screen too, so you'll have my email address.
Okay.
All right. Any other questions? I hope there was some information that was useful. But
Mhm.
again, you can call even if you just have a question. I mean, I'm a senior myself, so I enjoy helping people because we gotta, I mean, I'm not going to be yeah, I'm not doing it altruistically. I am an agent, so I do get paid, but I do answer questions for people. And anytime we talk, if there's a consultation, there's no charge. You know, that's all just all part of the game. You know, it's only if someone signs up, then they do, you know, pretty straightforward. They do pay us a commission.
Okay.
That's the way that works. Any other questions about anything? Oh, something I thought of too. During this time of COVID, a lot of the carriers, if there is a primary care doctor copay, a lot of those are waived, and I think on a lot of them, I'm pretty sure Empire, Humana, Aetna, like any testing connected to COVID, they cover that at no charge. You know, they're trying to help people out. And the companies are good. Oh, another couple of benefits they have, if some of them, if you're hospitalized, when you come out of the hospital, they have meals you can get, usually about 7 days, 2 meals a day, you know, so people don't have to cook. You know, they're not going to feed the whole family, just the person that's covered. There's gym membership. There's a free gym membership with the plan, even the supplement plan, which never used to have it, but the Empire one in New York has silver sneakers, if you've ever heard that term. And then United Healthcare has their own. I forget, there's a name to it, but it's similar. But the silver sneakers is a national program. Like, again, Lawrence, if you were traveling and you had a gym membership and you know, wanted to use a gym in another state, it's national, the Silver Sneakers program. So it's a pretty good thing. And again, if you do your travel, either a PPO or well, you definitely would, I would say either a PPO or a supplement plan that has a lower premium. The lowest premium that I know of is the N plan, which is about $190 a month through Empire and about $200 through United Healthcare. But then you have to get a separate drug plan. So PPO might be your best bet. Like I said, if you want to call and discuss them, you know, I can look up individual plans. Okay.
Thank you so much. I really appreciate this.
Oh, of course, my pleasure.
Yeah.
I like talking about it. Like I said, I'm very impressed the way Medicare works, you know, because you know what all you have to do is, a quick story. A guy I knew through a company, I also do supplemental insurance, you know, like Aflac, and a company, a client of mine at a company, he was excess because of COVID. He was, you know, they kept him on the payroll for about 3 or 4 months, and they let him go, and now he had to scramble to get health care. He was 61 years old, so he couldn't get Medicare, and he could get Cobra, but Cobra was $900 a month. That's a lot of money. So I told him, go on the New York State of Health, the exchange in New York State. He wound up getting a plan that he felt would fit his needs for $150 a month. So, but he had to scramble. Whereas when you're eligible for Medicare, there's some great plans out there. I mean, it's great coverage. Are the plans perfect? No, but you know, if you can get a plan that monthly premium is $0 or, you know, $20, you can't beat that. Even the highest price Medicare supplement plan at $300 is still less you would pay for private insurance.
Sure, yeah.
So I think it's good. Okay, anything else? Okay.
Good, thank you very much.
Okay, you know what, let me just put my info on the screen in case anybody wants more of it. Is that visible? Can you see it?
Yep. Mm-hmm.
Okay, so if you want to get my email address too, and that's
Sure.
not a capital P at the beginning.
It's not a capital. Okay.
No.
1947. Okay.
Okay, and I have a website. On there, you can sign up for dental insurance. But that's if you need separate dental insurance.
Okay. No. Okay.
Okay, you guys got it?
Okay. Yeah, got it.
Okay. Okay, did you get that, Lauren, for your dad?
I got your email.
Okay. Lauren, did you get that for your father?
That's what you said, Lawrence.
Yes, sorry,
Oh.
I lost the screen and I couldn't figure out where the go-to meeting was. But yeah, I have that, and I'll be talking to him, and maybe we'll reach out to you. Where are you based out of? Are you based out of Patchogue or
Holbrook,
Holbrook? Okay.
right next door.
Okay.
Thank you all for coming on and listening to me.
No, thank you.
Thank
Okay.
Thank you for your
I
time.
don't, and if you know other people and they want questions answered, you can share my phone number. You can share my email address. Okay.
Okay. Fair
I
enough.
Again, thanks for the good questions. I mean, we can learn something new every day.
You know, I've been trying to get through this Medicare process for so many years, but you need to just keep talking about it and hearing it again, because it's so many parts to it, and it can be so confusing.
It is confusing, and that's where, I mean, every year I have to recertify and I have to study and go on, take tests. It's
Sure,
not like
yeah.
going to college, but, because you have to be able to answer questions. And I can't answer every question, but I always tell people if I don't know the answer, I'll find out for you.
And that's a good trait. A very good trait.
I never guess, because if you guess, it's most likely going to be wrong.
Right.
All right.
Well, I'll probably be calling you, Paul, if that's okay.
Okay, Marty.
Thank you, Marty.
All
Whatever.
right. Take care.
Thank you, Jay, for doing this.
Okay.
Oh, of
Jay,
course.
take
Thank
it to
you.
the library.
Of
Mhm.
course. Thank you so much. Thank you, guys. I'm glad you found it useful. Paul, thank you so much for that very informative session.
Okay.
Guys, thank you so much for attending today and spending some time with us and learning about Medicare from Paul Donahue.
Yes.
Okay.
Okay.
All right, everyone.
Thank
Take
you.
care now.
Have
All
a great
right.
day.
Have a good
You
one.
too.
Thank you.
Bye
Bye-bye.
now.
Bye.
Bye-bye.